Hi, everyone. Welcome. Hello, welcome. You have found your way to the 2026 webinar series for Child Abuse Prevention Month. We are going to get started here in just a moment. We're going to let people find that Zoom link, make their way in here. I'm just curious to know who's in the room. So if you don't mind, just to kind of kick us off and kick off this month-long webinar series, would you tell me in the chat what field of work are you in? And what is one encouragement you would give someone on their first day of their job in your role? So, what role are you in? And what encouragement would you give somebody starting a job just like yours on their first day? Positive encouragement. What would we tell them? Tell me in the chat. What is your role? What's an encouragement you would give somebody in that role on their first day? And as you're doing that, we're going to be letting people in the background and we'll be jumping off in about, we're going to say 60 seconds or less. I'm giving folks a second to enter your thoughts. I'm also making sure that our chat is on. It is. Perfect. All right. CDSS, great. Advice of not being scared to ask questions and make connections. I love that, Mona. Sharon says, child welfare, be flexible and leave work at work as much as you can. Can we take a pause for some work-life balance? Thank you so much, Sharon. What else? For those of you that are just joining us, I asked a question to kind of kick us off for this 2026 webinar series. And the question is, tell me in the chat, what is your role? What's a positive encouragement you would give to somebody starting that role on their first day? And so, oh, great, we have parent partners. You would tell someone to focus on connecting with the team and the other people that we serve. I love that. If you're a teacher, I see patience. I love that. Being kind to yourself, that you do make a difference. Absolutely. Take it slow. There's a lot to learn. Great advice. Encourage someone to be open-minded, calm, and building rapport with your clients. Helpful to leave work at work. Leave home at home, work at work, right? We love that separation. Be yourself, be honest, and listen to your clients. These are wonderful pieces of advice. Sit in the uncomfortable feeling of trying to absorb a huge amount of information. Absolutely. Wonderful. Be flexible. Great. I think something that's unique about this series is that, well, you're with other professionals that understand this advice more than anybody else. And this is kind of that gathering spot for professionals like you, helping professionals in California. I think as we begin this series, I just want to remind you that sometimes the work can feel isolating when other people can't relate to it, but it's moments like this that remind us that we are participating in a statewide community. And hopefully a reminder that what you do plays a much bigger role for kiddos in California. So I will officially, since we are getting started here, I'm going to officially welcome you to the 2026 Child Abuse Prevention Month webinar series. Today's session is going to end at 12:30. This series was thoughtfully planned just for you by the Office of Child Abuse Prevention, the California Training Institute, or CalTrin for short, Safe and Sound, and the Child Abuse Prevention Center. Every Wednesday throughout April, we invite you to join us for a series of sessions to learn how to incorporate this year's theme, which is Strong Families, Safe Futures. When we care together, families thrive together, into statewide prevention initiatives. So I am curious because I'm nosy. Would you tell me if you've ever been to a CAP Month webinar series before, or is this like the first time that you've jumped in? Just give me a yes or no in the chat. Have you ever been to one before? Great. Welcome back. Oh, well, if this is your first time, you're in for a treat because this month there are 5 Wednesdays, which means we have a bonus webinar. So let me just kind of give you a little bit of information about today's session, which kicks us off. This first webinar is called State of the State. We will discuss programs and initiatives designed to transform services for children, and we'll focus on a prevention lens because prevention starts before harm ever happens, and it doesn't stop once a family enters the system. Child maltreatment prevention begins long before a report is made and continues at every step along the continuum of care, which many of you are at different places of that continuum. Today, you're going to hear how diverse programs are taking action at every stage to prevent harm, promote stability, and create safer, stronger futures for children and families. So here are a few notes before we begin. First and foremost, we've got a little pre-flight checklist for you. We have created an action sheet for this webinar series. The action sheet is designed to help you track key takeaways that you pick up and that you learn, maybe some next steps from every session of this webinar. You'll find that link that's just been dropped into the chat. That series action sheet is fillable and is a PDF. So you can type in your notes, keep it forever, print it, put it on your fridge, whatever you want to do. I'd highly recommend you click it now so that you have it for this session and the duration of the series. You should also note that external AI note takers will be politely escorted out of this session. They are not allowed due to California privacy laws. But you will get a recording of this session in about 2 days in a follow-up email to your registration email. So that will be helpful. You'll get that. This webinar and the ones that follow this month are designed with interaction in mind. In most cases, that's going to involve you adding your thoughts into the chat like we are today, maybe even showing your love to a presenter by giving them a reaction. That's a way to clap virtually. Maybe even coming off of mute to add your voice to the discussion when prompted. I'm going to tell you in a few slides what interaction is going to look like in today's webinar. See, thank you, Jennifer. Look at that, leading the way, giving us a little emoji. Portions of this webinar will be recorded and available after the session. We will provide that information in the 2-day follow-up. And lastly, you will receive a certificate of attendance after completing a brief survey at the end of the session. Don't you worry, that will also be available in that 2-day follow-up if needed. All right. Couple more notes, just a little bit about the agenda. We're going to begin with this overview of what the series looks like. Then you're going to have the opportunity to choose your own learning adventure today. We will have a series of presentations that are going to happen simultaneously in different breakout rooms. You're going to have the chance to choose which breakout room topic you want to attend for the duration of the session. And we'll give you the opportunity to join them. We're not there yet, but just so you know, that's what it's going to be looking like. As I mentioned, the 2026 CAP Month webinar series was thoughtfully planned and put together by several partners. If you're just joining us, I want to remind you who those partners are. The Office of Child Abuse Prevention, the Child Abuse Prevention Center, the California Training Institute, known as CalTrin, and Safe and Sound. Every Wednesday throughout April, we invite you to join us for the series of sessions to learn how to incorporate this year's theme. And the year's theme is Strong Families, Safe Futures. There's 5 sessions this year because there's 5 Wednesdays in April this year. And the very next week on April 8th is going to be If Help Had Come First, Lived Experts on Community Pathways. You can kind of see what the different topics look like. And you can learn more about that, register for all of these sessions in the QR code or on the website where you found this session today. With that, I'd like to introduce a presenter for us today, someone just to give us a little bit of context. I'm going to pass it off to Hillary Conrad, Bureau Chief for the Office of Child Abuse Prevention. Hi, Hillary. Good morning. How are you?
Hi, Jess. Good morning. Thank you so much for being here and a warm welcome to our annual Child Abuse Prevention webinar series. I believe this is our 7th one. Whether you're joining from a community center, your office, or even your kitchen table, thank you for being here. We're so glad that you carved out this time because what we do together matters. I also want to thank the incredible partners on the planning team. So thank you to CalTrin, Safe and Sound, the CAP Center, and even this year we had a couple of child abuse prevention councils join us. Without their help, their time, and their thought work, this webinar wouldn't happen. So thank you for making it possible. I want to start off with a reminder that each year, Child Abuse Prevention Month gives us an important opportunity to pause and refocus on what truly keeps children safe, which we all know is strong families. When families are supported, connected, and equipped with what they need, Children grow up in safe, loving environments where they can learn, heal, and reach their full potential. This month is not about pointing to problems. It's about spotlighting solutions. Prevention doesn't happen in one program or one department. It happens in neighborhoods, schools, clinics, community centers, and everyday moments. It happens when we reduce stress for parents and caregivers, when we listen to families and tribes, and when we create supportive systems that help people early before challenges escalate into crisis. A few years ago, I spoke at the Child Abuse Prevention Council coordinating convening, and I said prevention is hot, and it is just getting hotter, and it is because all of you are keeping that flame bright and growing it with intensity. As we begin this series, I want to ground us in a shared understanding of why prevention matters and why it requires all of us. Prevention is the unifying mission across every sector represented here today. Whether we work in state offices, county departments, home visiting programs, behavioral health, early childhood schools, or community-based organizations, family resource centers, we all contribute to keeping families strong and children safe. Prevention isn't owned by only one agency or organization. It is a shared responsibility and a shared opportunity. A broad, integrated approach to prevention allows us to support families earlier, more effectively, and in more dignified ways. When every sector strengthens its prevention lens, families encounter support long before challenges grow into crisis. This approach centers well-being and reduces the need for intrusive system involvement. Prevention lives across the entire continuum, just like Jess mentioned. There's primary prevention, which is strengthening families before harm ever occurs. Secondary prevention, catching risk early and stepping in with compassion. And tertiary prevention, healing after harm and breaking cycles for safer tomorrows. We all want to live in the reality where families are surrounded by a robust network of supports and services, where comprehensive care coordination connects people to what they need, and where community-based pathways make help easy to access and stigma-free. We want families kept together whenever safely possible, and children and youth empowered with the skills, confidence, and opportunities to create the futures they desire. This year's webinar series theme, Strong Families, Safe Futures, When We Care Together, Families Thrive, is more than a slogan. It's a North Star. It reminds us that child abuse prevention isn't just a program or a policy. It's a mindset and a culture we build every single day. Because when we care together across agencies, across disciplines, and across our state, we don't just prevent abuse. We build stronger families. We create safer futures. We prove that prevention is possible, measurable, and worth every ounce of our collective effort. I want to take a moment to acknowledge and celebrate you. Whether you're a frontline caseworker, a policy leader, an educator, a clinician, a community organizer from a family resource center, or a child abuse prevention council member, or a dedicated volunteer, you show up in the hardest moments and the quietest victories. You carry stories, you carry hope, and you carry the belief that families can thrive. Your work is not invisible. It is changing lives right now. Thank you. Cross-sector collaboration is key. Families interact with many systems, not just child welfare. So when professionals across health, education, public benefits, community organizations, community members, and local government work together, we create a more complete safety net. That includes shared referral pathways, consistent messaging, and a collective commitment to supporting families without stigma. And prevention is not only about stopping maltreatment. It is about promoting strong, connected, thriving families. By building protective factors such as economic stability, social connection, parental resilience, safe relationships, and access to concrete supports. We create the conditions for lifelong well-being. Reducing adverse experiences and increasing positive childhood experiences strengthens families for generations. And a kin-first culture honors family connections and keeps children rooted in their communities and relationships. Every professional here plays a crucial role in this work. State leaders set vision and policy. Local governments and county agencies bring those policies to life on the ground. Community-based organizations build trust, provide culturally responsive supports, and fill the gaps that systems alone cannot. Together, we create a web of support that is stronger than any strand on its own, like a blue ribbon woven from many threads, symbolizing our collective commitment to prevention. A prevention-centered approach reflects the values we hold and the future we want for California's children and families. We value dignity, belonging, and opportunity for every family. We want systems that are supportive rather than punitive, proactive rather than reactive. And by embedding prevention throughout the continuum of care, we move toward a future where families receive help when they need it and often before they even ask. Ultimately, our collective work is the path forward. Prevention is not a program. It is a culture, a framework, a mindset, and a commitment. When we align across sectors and across the continuum, we maximize our impact. When we work as prevention partners, every child, family, and community benefits. This webinar series is designed to inspire, equip, and connect us as we move prevention forward. Each session will spotlight real innovation, practical tools, and stories of impact. Together, we'll explore how we can embed prevention into the very fabric of how we serve children and families. Today's section kicks things off powerfully. We're diving into state initiatives that are transforming services for children and families. You'll hear directly from leaders who are reimagining systems, shifting from reactive to proactive, and proving that when we align policy, practice, and people around prevention, entire communities begin to thrive. So lean in. As Jess mentioned, it's interactive. Ask questions in the chat, share your insights, and let's make this space one where ideas spark, partnerships form, and hope multiplies. Before I hand things over, I have one last quick connection opportunity. Final icebreaker. Drop a flame in the chat if you're ready to be inspired today and committed to keeping prevention strong, or a seed or sapling if you're here to grow something new in your work. Look at those flames and seeds. I love it. Awesome. That's the culture of prevention we are building together. Thank you again for being here, and I will toss it back to Jess.
Awesome. Thank you so much, Hillary. And as she mentioned, this is a space for interaction. I want to tell you what that looks like today. This is different than any other prevention month that we've done as far as a webinar series. And you're going to have the chance to choose your own adventure, your own learning adventure, deciding on what you want to learn about, how you want to be inspired. And it looks like this. There are going to be a series of breakout rooms. There are 6 total on 6 different topics. Your job in the next 10 minutes is to figure out which breakout room do you want to go to. So how do you know? Well, thanks for asking. There's 2 ways. Number 1, in the chat right now, you'll see that there's a breakout selection form. If you click that now, you'll see the titles of the 6 options that you have for the breakout room. I'm going to play a quick video for you. In this video, the presenters within each breakout room are going to give you like a 1-minute sample of what you can expect if you join that breakout room. Your job is to decide which of the 6 you are going to join for the remainder of the series. We will not come back into this main room. You will actually conclude with the breakout room. So that's the decision that you have to make. I'm going to play the video. Why don't you go ahead and select your breakout selection form. So go ahead and click that. I'm going to play the video and then the breakout options will open and you will have the chance to self-select into one. Let's watch that video together.
Hello everyone, my name is Patrice Coleman and I'm the supervisor of the Kin.
Let me get that out there.
Centric Compass Unit here at CDSS, and we would love for you to join our breakout session today. We'll be talking about Kin First practices, family finding and engagement, and how strengthening connections can lead to better outcomes for children and youth. We hope you'll join us to learn more and be a part of the conversation. Thank you.
Hi, my name is Mandy Tiara, and I'm with the Kin-Centric Compass Unit. We know that California is shifting towards a Kin First culture. What Kin First means to me is keeping youth connected to their families and to people they know where they feel safe and supported and loved so they can be part of a caring community. With that being said, I'd love to share what we do more here and how we're promoting that Kin First culture.
My name is Gia Raybon Johnson, and I'm an analyst in the Kin-Centric Compass Unit, also known as KCCU. As we introduce the offerings of the Center for Excellence, you may be asking the question, how do we build a Kin First culture within our current child welfare system? The Center for Excellence and the Kin-Centric Compass Unit are working together to do so. One supports implementation and workforce development, and the other works to ensure policies and standards across CDSS systems of care are in alignment.
Hi, I'm Ashley Johnson with the Kin-Centric Compass Unit. As the culture continues to shift towards kinship care, I'd like to share a quote with you that best represents what kinship care means to me. Children don't just need a family, children need their family. Thank you so much, and we look forward to sharing more about our work with you in our breakout session.
Hi, everyone. Thank you for joining us today. I'm Bailey from the California Department of Public Health Injury and Violence Prevention Branch. We're really excited to be a part of Child Abuse Prevention Month and grateful to have you here with us as we work together to make a positive impact. Today, we want to invite you to a breakout session that highlights California's coordinated efforts to prevent adverse childhood experiences, also known as ACEs, promote positive childhood experiences, also known as PCEs, and strengthen our shared work through tools like kids data. In our session, you'll hear how our statewide child adversity prevention portfolio works together. This includes the Essentials for Childhood Initiative and the All Children Thrive California Project. You'll learn how these efforts coordinate to prevent ACEs and elevate PCEs. We'll walk through the evidence, what ACEs and PCEs are, why they matter, and how promoting PCEs strengthens and complements primary prevention efforts of ACEs. You'll also be introduced to a valuable resource, Kids Data. Kids Data is a valuable tool that can help you find and use high-quality data about the well-being of children and families across California. During this session, we'll show you exactly how to navigate Kids Data dashboards, where to find the data, how to customize it, how to interpret what the numbers mean for the communities you serve, and demonstrate how data can support programs, policies, and decision-making. By the end of this session, you'll be able to clearly define California's statewide efforts to prevent ACEs and elevate PCEs, and confidently navigate Kids Data dashboards to find the information most relevant to your work. We hope you'll join us for this engaging and informative session as we work together to prevent harm, promote stability, and create safer, stronger, and healthier futures for children and families across California.
As a professional working with children and families, you might encounter a moment like this. You see something concerning and you have to decide, am I looking at child neglect or am I looking at a family in hardship? The situation isn't always clear, and the decision you make about what happens next carries real impact, and that's what we're going to talk about. In this 60-minute session, we'll take the updated definition of general neglect, often referred to as AB 2085, and bring it into your real-world practice. This training is adapted directly from the Los Angeles County AB 2085 training and is designed to support how you think through these types of decisions. We'll walk through realistic scenarios, apply a simple decision-making framework, and explore how factors like poverty and access to resources can influence what we're seeing. This session was designed for mandated reporters like you and those that you may supervise. It's about increasing clarity, confidence, consistency in your decisions. You'll leave with practical tools you can start using right away and a clearer approach to balancing child safety with family well-being.
Hi, my name is Caitlin Foley, and I'm a project manager with the Children and Family Services Division at the California Department of Social Services. For the April Child Abuse Prevention monthly webinar, myself and partners from the State System of Care team will be presenting on AB 2083 and the Children and Youth System of Care. AB 2083 and the System of Care bring together systems at the state and local level to coordinate for children and youth. This establishes a local system of care and promotes collaboration and communication across child-serving systems to meet the needs of children, youth, and families. The system of care centers on the belief in one system and an integrated response to meet the holistic needs of children and families. Within our breakout session, we will provide an overview and share components of AB 2083 and the system of care, and discuss how these can be leveraged in an upstream approach. In statute, AB 2083 is written with a focus for children in foster care who have experienced severe trauma, but this collaboration can be extended well beyond this for systems to work together and leverage resources and support for children and families early and at every step of the continuum of care. We look forward to seeing and meeting you soon. Thank you.
Hello, everyone. My name is Mona, and I am a supervisor within the California Department of Social Services. I'd like to invite you to join our breakout session on CalWORK's Stage 1 childcare and the role it plays in supporting safe and stable families. For many families receiving CalWORKs, one of the biggest barriers to employment, education, or meeting program requirements can simply be finding safe and reliable childcare. Stage 1 childcare is designed to provide immediate support so that parents can participate in activities that move their families towards stability and self-sufficiency. In this session, we're going to talk about how Stage 1 works, who it serves, and how access to childcare can reduce stress on families and support broader child abuse prevention efforts. We're also going to share practical information on how professionals and community partners can help connect families to these services. If you are interested in learning how childcare supports prevention and helps families build safer futures, we hope that you will join us.
Hi, are you invested in prevention? Are you wondering what's happening at the state level around prevention? Are you wondering how you can join the state's efforts to create a kin-first culture that is focused on supporting families to provide safe, stable, nurturing environments and relationships for their children and youth? If so, please join myself, Jenny Perlman, and my colleague Siobhan Walker, both of California Department of Social Services, where we will give an update on the state's coordinated and comprehensive approach to building a system of prevention in partnership with our local partners at the county level, at the tribal level, at the community organization level. We'll talk about work we're doing, again, in partnership to transform mandated reporting, to invest in each community in prevention through the Family First Prevention Services Act program, as well as through building community pathways. And we'll focus on how all of this must be grounded in principles of harm reduction, trauma-informed services, and equity. We hope to see you soon. Thank you. Bye-bye.
Great. So now you have a decision to make. What we're asking you to do is you are going to determine which of the 6 breakout rooms would you like to attend. You're going to choose one, and you're going to spend the duration of the next hour until this session concludes at 12:30 with your presenter. The only way to select is we are going to place the breakouts on the screen, and you are going to self-select into them. So if we can have that up and ready, please.